The aim of this presentation is to give you an understanding of relaxation, to increase your awareness of the potential health benefits of relaxation, and to look at different types of relaxation techniques for you to carry out some of your choice. Firstly, I'd like you to think about how you manage any stress and anxiety that can occur with having a respiratory condition. This is because there is evidence to suggest that having a respiratory condition increases the likelihood of you experiencing an increase in anxiety and stress. Everyone is different in how they manage their condition and the additional difficulties day to day that it can bring. For some, it's not so much of a problem. For others, it weighs much more heavily on their well-being. Possible examples of daily stresses could be keeping up with appointments and tests that you may have to remember and go to. Perhaps it's getting through your daily routine of things you need to do, but you find your condition gets in the way of you doing. You might experience symptoms of anxiety when you feel breathless, or start thinking of worries and thoughts it's hard to escape from. Take a moment to now consider this question for yourself before you continue with the session. Have you heard of the fight or flight response? Imagine when there were cavemen and women. Imagine someone sat by a fire and out of the corner of their eye, they see a threatening animal coming to attack them. In that moment, part of the caveman's nervous system in the brain would trigger danger, known as the fight or flight response. This response made the body produce different hormones to make the body more alert and ready for action. This was very useful for the caveman in terms of survival, as it allowed them to perform at their best and either fight the creature or run away as fast as they could. This response is still present in our brains today, but it is not always triggered by physical danger. It can also be triggered by our worrying thoughts. Basically, anything our brain perceives as a threat to our well-being can trigger the fight or flight response. It is actually a very useful and natural response to have, and we can't control when it triggers entirely. What we can do, though, is manage the symptoms it causes when it arises. An example of this could be when you get extremely breathless. You might struggle to control this at times, and your brain can activate the fight or flight response. This can actually make the breathlessness worse. Can you believe? Let's see how on the next slide. So here is some examples of the effect of the fight or flight response can have on our body, sometimes mild and not noticeable, sometimes significantly. If you read the slide for the examples, as you can see, whilst in this state, your breathing naturally becomes more breathless, as you already have a respiratory condition, and breathlessness can already be a significant symptom. This shows how the breathlessness can be exacerbated further by worrying thoughts that can come up, even though you are not being very active at the time. Learning how to manage this can be very important for managing respiratory symptoms when feeling stressed or anxious. Here are some of the effects of stress. As you can see, there are many. Thinking about relaxation and how it fits in with what we've been talking about, take a moment to consider how you tend to usually try and relax on a daily basis. Is it a certain activity you do, or a place you like to go? Take a moment to think before continuing. Now consider, what do the terms relaxing and relaxation mean to you? Do you think there is a difference? There can be many activities we find relaxing and enjoyable which help relieve stress through participating in them. But true relaxation is actually a skill, an exercise you practice and purposely engage in. It can bring about something called the relaxation response in our body. The relaxation response, which is a state of deep rest, is the polar opposite of the stress response. It can, of course, be triggered naturally in situations we are in, but relaxation exercises can help us enter into this state on a more regular basis. To better understand the relaxation response and its benefits, let's have a look at the next slide. On the left side of this picture is the fight or flight response. It increases our arousal in a situation, with the heart rate, breathing, etc. On the right side, you will see the arrows pointing downwards. This is the effect of the relaxation response. It works in the opposite way, to fight or flight response, in calming the body's physical responses. The relaxation response is another part of our nervous system. It is activated when our brains perceive no nearby threats or worrying thoughts, and is essential to promote some of the body's functions like strengthening the immune system, slowing the breathing down, lowering our blood pressure, and generally feeling in a more relaxed state. Although it's entirely natural to experience the fight or flight response regularly, trying to activate the relaxation response can be an important factor. It's all about gaining a balance. There are exercises you can practice to help activate the relaxation response on a daily basis. We will discuss this shortly. Relaxation can support you with having more self-control on how you deal with stressful situations. People may tell you to relax in a stressful situation, but how do you do it effectively? It is worth practicing and can take time to feel benefits. These are some of the possible benefits of practicing relaxation. Where is a good place to start? One of the first things to look at, and you might have done some of these before from participating in other Impact Plus courses, in breathing exercises. Purposefully finding ways to slow your breathing rate down when you are feeling breathless and when you aren't can be a great way of activating the relaxation response. There are many different breathing exercises you can try. Diaphragmatic breathing is just one. Have you heard of it before? We often don't breathe with our diaphragm and instead rely on different muscles which don't give us ability to breathe in as deeply. When you breathe in, activating your diaphragm, you may notice your stomach naturally expands out. When you breathe out, the opposite might happen and your stomach shrinks in again. To start with, you might find it helpful to put a hand on your chest and a hand on your stomach. Try taking a few purposeful breaths. Do you notice your stomach hand moving when you breathe in or your chest? If it's your chest, you may not be using your diaphragm effectively. Try it again. And try imagining air entering through your nose and travelling down into your stomach and expanding it. You might find that practice breathing with your diaphragm helps you take deeper breaths, which can feel relaxing and help activate the relaxation response. The diaphragm is just like any other muscle, and if not exercised, becomes weaker. You might find it difficult to locate and use your diaphragm when breathing to start with. If this is the case, then speak to one of us at Impact Plus and we will talk you through it in more detail. It's important to know that this kind of exercise can make you feel a little lightheaded to start with, and practicing it in a safe place is essential. Some people try it at night time whilst in bed, whilst others prefer sat in a quiet room. If you start to feel lightheaded, just stop and let your breathing return to normal. Here's another breathing exercise to try. This is from the website NHS Choices and can be a simple one to practice with. Let your breath flow as deep down into your stomach as is comfortable, without forcing it. Try breathing in through your nose and out through your mouth. Breathe in gently and regularly. Some people find it helpful to count steadily from 1 to 5. You may not be able to reach 5 at first. Then, without pausing or holding your breath, let it flow out gently, counting from 1 to 5 again, if you find this helpful. Keep doing this for 3 to 5 minutes. Please get in touch with us if you would like more information. Have you heard of mindfulness? Although mindfulness isn't strictly a form of relaxation, often the practices of mindfulness exercises have the side effect of relaxation response being activated. Mindfulness is an ancient practice which focuses on the belief that our minds often move us away from the here and now with thoughts and memories, among other things. It is the concept that you cannot control what type of thoughts and feelings you experience. There is research to suggest you can have over 50,000 thoughts a day. Some of these thoughts may be positive, while some may seem negative and intrusive. Mindfulness skills is learning and practicing regular exercises that help us notice and become better aware of our thoughts, and it can support with our ability to become swept up in them. By learning mindfulness techniques, we can learn to bring ourselves back to the present moment, whilst understanding it is entirely normal to need to repeat this cycle throughout the day when we notice our mind has wandered again. Mindfulness as a topic is far too big to cover in one session. Instead, we would like you to know that the Impact Plus occupational therapists can support you with learning some of these skills to help you achieve a better well-being and independence in your activities day to day. Body scanning. This technique can be a useful way of recognising tension and stress within the body. It can be undertaken in many locations and you do not need an audio recording to try it, although you might find this helpful. Strictly speaking, this isn't a form of relaxation per se. Often a side effect of this mindfulness meditation is the relaxation response, making it a useful technique to include in this presentation. Possible benefits include improved sleep, help with fatigue, among many others. It can be a good technique to try due to the connection between your emotional and physical well-being. You could lay down, for example at night before bed, and complete the exercise, or for a quicker version, you could sit and complete a brief version of the body scan. Briefly scanning through your body and noticing any tension that arises. You will see a link on the screen which is an audio exercise designed by a University Hospitals of Derby and Burton staff member you are welcome to try. Click on the body scan meditation to begin. Relaxation can include imagining scenery and different places. Quite often this might be somewhere you have visited or that you've found especially peaceful and beautiful, a journey you've been on or a positive memory. Choosing a setting that makes you feel peaceful, calm and free of tension. When doing visualization, you might find it easy to choose a quiet location within your home, away from distractions, with the curtains closed and your body, head and neck supported in a comfortable position. It is about building up the image in your mind. What can you see? What can you smell? What can you hear? What can you feel? What might you taste? It might be conjuring up a pleasant memory of the past or imagining a serene place you've seen on the television or in a book. The location doesn't matter, as long as it is relaxing and calming to you. Things to be mindful with visualization. If you've had an experience in the past in a specific location that was unsettling and may have caused trauma, imagining a visualization in a similar place or setting may not be useful. Listening to an audio script featuring a past event can have the opposite effect to what is actually intended and actually causes further distress. I know this can be complicated territory, so it is best to speak to a health professional, such as the occupational therapist in Impact Plus, who can guide you with this further if you think it may be an issue for you. Visualization is very versatile. You could listen to a selected noises to set the scene or use an audio recording online to take you through a guided visualization, such as a walk on a beach. There are phone apps you can download with visualization scripts, or you could just simply lay down and create your own scene in your mind, using your senses to build your own picture of peace and relaxation. Having certain smells around you may help set the scene as well. This type of relaxation is a skill that grows with practice. To start with, you might find it difficult to focus on the same scene, and your mind will wander to other things. This is totally normal. Just keep bringing your attention back to the visualization you have chosen. A guided visualization script may be helpful for beginners because of this. There is no right technique for all. What works for one person may not work for another. The best thing to do is try the ones you find appealing or have been recommended. For them to be more effective, we advise regular practice daily, if possible. We've not been able to touch on all relaxation exercise today, so these have just been a small number of what's available. Here are some websites and apps you may want to visit for further advice and support. Impact Plus occupational therapists can support you in improving your relaxation skills and provide you with additional exercises that you can try. You might not know quite where to start with this sort of practice, which is absolutely fine. Sometimes relaxation might not be the right support you need. Talking this through with an occupational therapist can help you work out a plan to help with daily stresses and anxieties that can regularly appear with a respiratory disease.